Hi, this is Andy Armacost. I'm the president of the University of North Dakota, and thanks to everybody for joining us tonight for this informational session. And I'd like to first thank all of my colleagues, the senior leaders of our institution who are here tonight to answer your questions. And to all the students and family members who have signed in, thanks for joining us. This is a very good way for you to get the most current information about what's happening on the campus, and in particular with respect to COVID and our response to COVID. Let me encourage you at this point, start writing your questions. I'll say a few more words, but as you're writing your questions, this will give you a little time to actually get your thoughts put down into the Q&A section. So please use the Q&A section of Zoom to make that happen. So we're all delighted to be here. A lot happening in the world of pandemic response, and I know we'll touch on some news today about testing and new testing strategies that are emerging, it looks like, for the spring semester. And then also, in addition, we have new approaches, or sorry, frog in my throat. We have new approaches for quarantine and isolation, particularly quarantine, so that if people are close contacts to infected persons, the CDC recently changed their guidelines about how we should respond, and the state and the university are going to follow those CDC guidelines. So we'll share more about the details of that as we open up the questions and give you our answers. So we're delighted you could be here. We know this semester has been one of the most unusual we could expect. And so we thank you, the students, and also all the family members for sticking with us, for focusing on your studies and really finishing strong. We know this week is last week of classes, and then off to final exams. So we're proud of you. We know that you've worked hard, and we're really eager to see you finish the semester strong. So with that, let me turn it over to Cassie Gerhardt, our Associate Vice President. So please, Cassie.
Thanks, President Armacost. As President Armacost said, my name is Cassie Gerhardt, and I have the pleasure of serving as the Associate Vice President for Student Affairs and Diversity. And just to let everybody know, as President Armacost said, we welcome your questions in the Q&A feature. As a reminder, following tonight's town hall, we will record this and transcribe it and make it available for future reference. In the next couple of days, it'll get posted on the COVID part of our website for future reference. As in other town halls, I'll just ask my colleagues as I pass a question to you, if you could please introduce yourself and state your title, we would appreciate it. So Provost Storrs, I think a lot of these first couple of questions we're getting are probably going to come to you. We're getting questions related to academics. So the first one I'm going to pivot to you is, how will instruction be offered for the first 2 weeks of school in January? And as you talk about that, could you also talk about flight operations?
Sure. Good evening, everyone. I hope your semester is going well and you're ready for your finals. So in spring semester, we're going to start as planned with the typical both on campus and online. So if you've got your course schedule in front of you, or if you want to access it, it'll tell you which courses are online and which are face-to-face. You can also check your Blackboard site to see what instructions your faculty might be giving you about your online or your on-campus courses. So we'll begin campus spring semester as typical, like we're doing now, and flight instruction is planned to continue as typical right now. So things could change, but we're hopeful that things will continue as is, and we can all start the spring semester strong and focused and in person.
Provost Storrs, staying on the spring semester, we've got a question of, do you know if many students are going to be staying home next semester, or do you expect normal numbers in the spring? Any thoughts on where we're at in terms of students returning for the spring semester?
Sure. So I can tell you in terms of how many classes that we have scheduled to be on campus and online, and currently the vast majority are face-to-face on campus. So about 67% of our classes are offered on campus and the rest are offered online. Based on the data that we have thus far, we expect most students to be returning to the spring semester. They've had a good fall semester, so we anticipate to have the same number of students returning. There may be an occasional case where students need to take a break, and we're happy to work with them if they need some support.
Okay, another question. And with the weather right now, it's hard to imagine we might ever experience a snow day, and some of us would like them to stay away for a little while longer. But for those of you not in Grand Forks, the temperatures the last couple of days have been in the upper 30s, low 40s. It is hard to believe it's December. But Provost Storrs, people are asking, how will snow days be handled in light of remote learning? So if you could reference thoughts on snow days, should we ever get one?
Sure. So I'll open it up to others to jump in as well if you have a different opinion. But, you know, when snow days happen, it means that people can't get out of their house, and means that faculty who might have children or other family members they're caring for, they can't access daycare and those kinds of things. So on a snow day, typically there are no classes, and you would get informed of that via text or email. Jed, can you confirm that in terms of the communication process to our students, or maybe
Yep.
Summer?
Sure. I'm going to also ask, I'm Jed Shivers. I'm the Vice President for Finance and Operations and the COVID lead person. And I'll ask Chief Eric Plummer, who's our Associate VP for Public Safety, to also comment. But yes, I think, Debbie, you have it exactly right. Generally speaking, on a snow day, you know, we suspend activity. It means that people really can't get around. It's either too safe to drive or too cold to do much of anything. So too unsafe to drive, sorry. So I think, you know, my sense is, in spite of the fact that we have remote capability, we would probably close. And Eric, Chief Plummer, would you like to comment further on that?
Yes, that is correct. One of the things that we anticipated early on during the pandemic was, since we are now remote learning, how would this affect the snow day operations? So we did a tabletop operation just to kind of see what people were feeling about on not only the on-campus operations, but also the academic environment. And for much of the reasons that Provost Storrs and Vice President Shivers mentioned, we decided to go ahead and continue snow days as they have been in the past.
Great, thank you. We're going to shift gears away from COVID. And President Armacost, this question is for you. And Bill Chaves, you may be ready and have some follow-up. President Armacost, the question is, with regards to the 2 hockey players who kneeled during the hockey game last Thursday, what is being done to address future happenings like this?
So this is a really good question. And let me tell you about what led to this, of course, and that's the players' belief in making statements about injustice in our society and lack of inclusion. And so they felt their conscience would put them in that position. Of course, last Friday, I issued a statement to the campus that said, with regard to action being taken against the 2 hockey players, there's no action, that they have the right to express themselves freely. It's a guiding principle of our Constitution, our First Amendment rights to free speech. And so future instances, we don't know what will happen, but rest assured that the issues of diversity and inclusion are discussed actively within UND athletics. There's student athletes for inclusion and diversity. It's called SAID, and then the Student Athlete Advisory Council talk about these issues within teams. They're talking about issues of race and equity, and so the main way to really reassure those players is to have welcome ears, both from their coaches, from Bill Chaves, our athletic director, and from all of the senior administrators, to make sure that they know that their voices are being heard. And so yet the possibility still remains that people choose to make a statement, and by kneeling. And if they kneel again, whether it's the hockey players or some other athletes, rest assured that that's a First Amendment right that they can execute. But nobody should ever do that by taking this lightly. That the national symbol, the national anthem, and the flag are important to so many people in our nation, the veterans who have given their lives, the veterans who have survived tough situations. And And to go to make that statement is, it really, I've heard a lot from veterans this past week about how it makes them feel. Nonetheless, the statement, the righteous cause of those who take a knee and the decision to do so is one that won't be punished by the university. Bill?
I appreciate that, Dr. Armacost. And last week you put out a video too, and I thought articulated that well. Obviously, we've got a task force for inclusion and diversity and equity that is doing great work on campus. And I think anytime that you have opportunity to have great conversation on a campus, it just provides opportunity. And I think that's where we are at this point in time. And you've articulated it correctly. We do have a student athlete inclusion and diversity group, and they've done lots of good work thus far, and will continue to do good work as we move forward.
And then let me also turn it to Kara Hallgren. Dr. Hallgren was the co-chair of our task force on diversity, equity, and inclusion, and she's been instrumental in laying a great foundation for the future of our campus. Kara?
Thank you. My name is Kara Hallgren. I serve as the Vice President for Student Affairs and Diversity. And the only thing that I'll add here is that we know that sometimes these conversations are difficult. And what gives me great hope is that in the last several months, as we've talked as a task force, we've grappled with some really challenging ideas. And they're not ideas that we all agreed on, like this particular incident. I don't know that everybody always agrees on, the response. That's not the most important part. The part that I think is important is that we create space where people can have articulate and respected dialogue about these issues, and people can wrestle and grapple with them and come to their own understandings about what they believe and why. And I think, again, that's the greatest thing about being at an institution like UND, where there is space to do that. And so we look forward to more conversations as part of the DEI task force and others later on.
Thanks. We're going to switch back to COVID, and we've got some questions related to the vaccination that is on the horizon. So Rosie, Dr. Nguyen, these questions to the two of you. Rosie, I'll start with you. Will UND be able to offer COVID-19 vaccines to students once it becomes more readily available? And then any prospect as to when that might be?
Sure. Good evening. My name is Rosie Dubin, and I'm working as the Director for UND COVID Clinical Response. The vaccine will be available to UND students and general faculty and staff, but certainly not in the first round. The COVID vaccine will be passed out and distributed based on priorities and tiers, with the first priority being frontline healthcare workers, so they can stay well enough to take care of our COVID patients and our other patients. Then secondly, probably likely to be the long-term care and the most vulnerable, the long-term care workers and the residents. Following that, it will again phase out into the more general public. So depending on what your risk categories are, you may fall in a different area. But I would expect what we're hearing now is that the vaccine for the general public and students likely will not be here until maybe late spring, early summer. But yes, we will be vaccinating everybody, faculty, students, and staff. I believe there's a question too about, will UND be a hub for storage and distribution for vaccine? I saw that on the chat line. We were fortunate ahead of time to get into our possession a freezer that is an ultra low temp freezer that will store some of the vaccine. However, all through this, we've worked closely with our community partners, meaning Public Health, Altru, and the other entities in town, and recognize that we will offer up our services and our space to work with them. So we may likely store some of that vaccine, but it doesn't mean that we will be able to access that at this time. So we will follow the state plan for what the distribution will be, but yes, we may be storing some of it on campus.
Dr. Nguyen, anything to add to what Rosie shared? Sorry.
Hi, Josh Nguyen, Vice President for Health Affairs and Dean of the School of Medicine and Health Sciences, and a physician and public health specialist as well. No, I think Rosie covered it very well. As you probably know from the news media, there are 2 candidate vaccines that are already being produced. We expect that there will be what is called an emergency use authorization for them this week and probably next week, and the vaccines will ship immediately thereafter. The distribution to different states is being determined by the federal government, but the distribution priority within the state is determined on a state basis, as Rosie mentioned. So initially, the state of North Dakota is going to get a relatively small supply of vaccine, but it is anticipated that that will increase substantially in the coming months. I agree with Rosie's prediction, though, that for otherwise healthy young students, for example, I would not expect there to be vaccine available in the first quarter of the coming year, but we do expect it in the second quarter, maybe into the third quarter. But I think when we think about a year from now, I think the pandemic situation is going to be substantially and dramatically different. But I do not think the New Year's gift to us on January 1st is that COVID will disappear. It will take a number of months beyond that until we get enough people vaccinated that we get what is called herd immunity, where we have enough people with protection that almost everyone gets protected. Thank you.
Thanks, Dr. Nguyen. Rosie, another question for you still on testing. A question has been raised, will students be asked to get tested upon return in January? And what's the spring testing strategy?
I think that is something that is up for discussion. We can assure students and parents that we will have testing. Whether or not that will be required is something to be determined yet. We are going to continue our weekly PCR or mass testing events, but in addition to that, we are making roll out what's called a rapid antigen testing that would be more accessible and more available to more students, faculty, and staff on a much more regular schedule. The antigen testing, you get the results in 15 minutes. So it's a point of care test, and we would like to set up sites across campus that would allow easier access for students, faculty, and staff, and allow us to have quicker identification of a positive case, much quicker isolation of those cases, and follow-up contact tracing. Testing will be a very big, crucial part of the spring semester, especially at the onset, until we do have a vaccine that is available to all of us.
Thanks, Rosie. Vice President Chivers, Jed, I've got a question for you. What do numbers of positive COVID cases look like on campus? And when do you decide to go online only? How high do numbers need to be in Grand Forks and on campus to warrant only online instruction?
So I actually, turned to our dashboard, and I hope people that ask this question go onto the main UND website, and you'll see a COVID section, and you look on the left side when you open up that page, and you'll see a thing that says UND COVID-19 dashboard. Click on that, and you have all the stats. So right now, total faculty, staff, and student positives are 57. That's quite low for us. There could be a whole bunch of reasons for that. I know that our recent student positive testing rate from our latest testing event was very low, about 2%. But again, it's hard to know exactly what's causing that. It could be that, a lot of people are not on campus, et cetera, et cetera. But it's good news. It's a lot better than having a much higher result than as we did before. And I think anyone who's aware of this area knows that it was a pretty hot spot and still remains a hot spot in terms of the number of positive tests per week, in terms of hospitalizations and so on. So, and now to answer, I think what the main question is as we've said, fairly consistently through these months, there really is no magic number that determines whether or not we're going to go online completely. And the reason for that is because the number of cases, for example, isn't really determinative. It's certainly an indicator. But what we really look at is the things that we look at almost every day. I can assure you, I would say that there's a lot of people on this Zoom look at this stuff every day. And what we're looking at is number of positive cases, what's the status with our local healthcare providers and the hospital, what's happening around the state, where are we? And whether we've hit our wave and now that wave is cresting, or there'll be future higher waves, I don't think anybody can say. But really it is a multivariate type of analysis. I'm not going to suggest it's numerical. I think it's an understanding of what's going on in our region and most specifically locally, and we make our decisions on that basis. Best thing is for people to continue to observe until there's ubiquitous vaccination. Best thing is for people to observe the same kind of safety standards that they're observing. Wear a mask, keep your distance, try and work in less dense areas. Those are the ways in which we've found to be extremely successful. And that's how we've been able to, in conjunction with all the efforts of the state, the federal government, and our local elected officials and healthcare providers and public health, that's how we've continued to keep our campus open.
Thanks, Jed. Rosie, a question for you related to testing. Is testing on campus confidential?
Testing and results are definitely information that we keep very private or confidential. Because it is a public health issue, there is some leeway that whenever there is action to be taken to protect the health and safety of the campus or environment, certain information can be released to appropriate bodies. So with that, if we need to identify a group that is at high risk for spreading the disease, like say if we identify a case in a specific area where there is high risk of spread, we need to alert that area that there has been a positive case in that area and then go from there. We base our information or any kind of release of information strictly on need to know. So it is not something that is freely shared by any means. Anytime we release any information to anybody, it requires a public health response to that information.
Rosie, staying with you, have UND students who have recovered from COVID-19 become reinfected? Are we aware of students who have become reinfected with COVID?
I am not aware definitely of that. We know that if people test positive and they retest within the following 90 days, they may still test positive, but that does not mean a reinfection. So if somebody is testing positive again and getting reinfected, they would be definitely worked up by a public health official and to make sure that there were new symptoms or that they were recently around someone who was positive again. I do not have confirmation of a student being reinfected, but I can't say that that hasn't happened yet.
Thanks.
Maybe I can just add a little bit from a medical standpoint. There have been a handful of cases reported worldwide where it has been reasonably well documented that people became reinfected. But we in the medical community believe that this is rare. It does occur, but it's not common. I am not aware either of it happening not only at UND, but within the North Dakota University system. And in fact, the most recent reports about the protective effect of getting both the disease and especially getting vaccinated is that long-term protection looks like the rule rather than the exception. Time will tell. We don't have all of the data yet, but we believe, especially after the vaccine, that reinfection or infection is going to be quite uncommon.
Dr. Nguyen, I'm going to take this question to you, and Rosie may have a follow-up. We've got a question. Will out-of-state students be able to obtain a vaccine? If a vaccine is available to students in May and they can obtain a dose, can they get a dose in one state and their follow-up dose in another state?
So I would give a qualified yes to that. And there are two parts of the qualification. One is that we will need to make sure that there is coordination of the medical records and their legal and other aspects of that have to be looked at. The second is with different vaccines, it's very important that a first dose and a second dose are of the same vaccine. So there are two candidate vaccines that are about to be released, one from Pfizer and one from Moderna. They are similar but different. And for instance, one of the differences is that the Pfizer vaccine is given at 3-week intervals and the Moderna at 4-week. You do not want to confuse the two. So I believe that out of state will be able to be accommodated, but we need to verify that, and especially verify that the individual is getting the same vaccine rather than one of each.
I can add a little bit to that our student health clinic has been anticipating that throughout the summer and probably in the fall, that students are going to be coming back, needing their second dose. And as Dr. Wynn mentioned, we're going to need to be sure we know what brand, that's what you say, of vaccine they had, so we give the appropriate one. This is kind of an opportunity to, being there so students and parents on here, to plug the public health information that this vaccine does not come without side effects, that nothing that should really keep you from work or school, but you will perhaps notice achiness, a low temp, maybe headache, fatigue. We just want to let people know about that ahead of time, so when they receive their first vaccine and they experience those symptoms, they aren't deterred from receiving the second vaccine, because they need to have the complete series to be protected. So just know that this one will make you a little bit more uncomfortable than your tetanus diphtheria shots have been, but they're tolerable and expected, and know that you do need to come back for the second vaccine.
Maybe let me mention one thing really fast, if I might, Cassie,
Yeah.
on following up on what Rosie just said. These are not viral vectors that are given in the vaccine. So you are not, I say again, you are not getting a mild case of COVID from the vaccine. This is just a reaction to the material in the vaccine. It is impossible to get COVID from the vaccine. Those mild symptoms are not due to what you're getting. It is not what we call a denatured or killed virus that you're getting. It is absolutely not. You can't get COVID from the vaccine.
Thank you. While we're on vaccines, Dr. Hallgren, I'm going to give this question to you. I know this is far in advance, but would UND require a COVID vaccine once it is readily available?
You know, the NDUS allows for...
Karen, could you explain NDUS for folks?
Sorry,
just to get clarification. Thank you.
Thanks. The North Dakota University System, which is the system made up of all of the universities in North Dakota, minus tribal institutions, private institutions. Right now, we actually require certain vaccinations for students to come to school. Whether or not this would be added to that list of required vaccinations has yet to be determined. However, we would say that at this point, this is a conversation that's currently taking place. I think we're going to have to wait and see what happens in terms of vaccines being available and how the conversation goes. But we currently have a path available to us if we decided that we wanted to do this as a system.
While we're on vaccines, Dr. Storrs, I'm going to give this one to you because it's even more specific. Is there guidance about flight students receiving the vaccine? Will the FAA pull their medical if they get it prior to FAA approval?
Yeah, thanks for the question. Unfortunately, there's no definitive answer on that yet. The FAA is monitoring that, and our leadership at Aerospace is monitoring that as well. So as soon as we learn, we will share that with our flight instructors and our students who are flying.
Thank you. Vice President Shivers, I'm going to bring one to you, a question. Do you anticipate any quarantine or isolation requirement for students upon returning after the winter break? So when students return in January, any anticipation of quarantine requirements? Oops, Jed, you're still muted.
Thanks, sorry about that. So in other words, question is, just because someone's returning from not being in Grand Forks, would we quarantine or isolate them?
think it's also similar, Jed, to what some students experienced at the start of the fall semester, and especially to students maybe coming back from Canada. If you could just address what we're aware of at this point.
So I can't actually speak definitively to the Canadian question, and I'm going to punt that one up to Chief Plummer, see if he has any thoughts on it. But I would say generically with regard to students arriving from places outside of Grand Forks, unless we have specific information that an area is particularly hot, and we've been alerted to that by our State Department of Health, I do not anticipate any kind of generic requirement to quarantine or isolate. I do think it's going to be critically important for students to get tested. I would say the most important thing that they can do would be upon arrival to get tested right away, see what their status is, and we'll work it from there as we always do. But no, I don't foresee any particular, generic quarantine as a function of arriving from a place outside of town.
Yeah, Cassie, earlier in the spring and in the fall semester, we had a state health officer's order that really spoke to the need to quarantine and isolate coming from either foreign locations or locations within the United States. That health officer order had been rescinded. So unless we get another health officer order that speaks to quarantine and isolation requirements, we don't have that right now, and we will communicate that if it does become available. We'll communicate that out to the broader campus community.
And just to make sure we're getting all aspects of this question, there was a follow-up. Will students need to produce a negative test result before attending class? And to our knowledge, there is no expectation of this. So just to clarify and get all parts of that question. Rosie, a question for you. Should students who recovered from COVID-19 who return home for Christmas break or the winter break remain masked while indoors at the family home? Can they carry the virus in their nasal passages even while being immune themselves? So if someone has recovered from COVID in that 90-day window, can you speak to that?
We do have what we call presumed immunity for those 90 days following a positive test, which makes them kind of golden in our book, meaning they should not be infectious to other people. With that, I would say that no, they can go home and they don't need to mask indoors with their family. However, we want to use every tool that we have in our toolbox. So even though you've been positive and you're within your 90 days, we do ask you to still follow the basic principles of distance when you can, wear face coverings when you're out and about with people, wash your hands frequently. So you don't want to challenge that immunity either, but no, you would not need to be wearing a face mask in your home. Dr. Wynn, do you have anything to add to that?
The only thing that I would caution for all of us, this is students, faculty, staff, families, and so forth, is to not let our guard down. We are quite concerned that there could be a resurgence of the virus and nullify the good gains we've made in North Dakota over the last week or so if people are not careful over the holidays. So the things that Jed mentioned remain important, that if you're interacting with others, to wear masks as appropriate, wash your hands, keep your distance, and especially for all of us thinking about holiday get-togethers, to try to be as judicious and careful as we all can be about those holiday get-togethers. I like to say that the best size of a group is one person. Now, obviously, that's not practical around the holidays and so forth, but keeping the gatherings as small as possible is clearly advisable. And it's what Susan and I have decided to do for our holiday time, as painful as that is. And I would just ask everyone to think hard about the size of gatherings over the holidays.
Rosie, you talked a little bit about the 90-day immunity. There's another question. If a student has already had COVID, do they need to continue to get tested? So could you speak to it both in the 90-day immunity as well as beyond the 90 days?
The guidelines that we have right now is if you tested positive, you should not test within the next 90 days. Based on, you still could, some of the tests are so sensitive, you could have a very low viral load in your system yet that could throw a positive test, but you're no longer infectious. So the principle is being, don't test for 90 days after you've been positive, with the caveat that if you would become symptomatic or have new symptoms arise again, you should consult with your medical provider and they would determine whether or not you should be retested for COVID, probably after ruling out other infections or other illnesses. What was the second part of that question, Cassie?
Then beyond the 90 days, when should people start testing again?
Again, I would answer my response would be based on what we do for the general public and all the students. And that means after 90 days, you go back to square one, meaning at that time, if you are identified as a close contact, you are going to be asked to quarantine again, and you could be retested again after your 90 days, is what I understand. I also will throw a little part in there. Some different bodies may have different rules, such as NCAA, and those kinds of things may govern slightly differently. If anybody has anything to add to that, please do, but that's where I would be right now.
Great. Rosie, another question. Is UND adapting to the new CDC quarantine or isolation guidelines? If you could speak to that.
Yes, we are. We are in compliance with the CDC guidelines. And unfortunately, we've been working yesterday and today to try to get them up on the blog corrected. They're ready to go, but yes, we will. The guidelines have basically changed. There are a couple of things that have not changed. One is that if you are a positive case, your isolation period has not changed. You still need to isolate for 10 days. However, quarantine period has changed. That is reduced from 14 days to 10 days. You also have the option of 48 hours before day 7, which is your 7th day of quarantine. You could test and get a negative test and test out at 7 days. You can't quarantine less than 7 days, but you could potentially test in that time frame and be released at the end of your 7th day. I was asked a question earlier today that at the earlier town forum, I said that you want to test on day 6 to get out on the end of day 7. And that goes with the understanding that your quarantine ends at 11:59 p.m. on day 7 if you get a negative result and if you don't have symptoms. The only way to meet that 48-hour interval is to actually test on day 6, unless you can find somebody to test you at 11:59 p.m. on the 5th day. So that's why we say test on day 6 to get out on the end of day 7. And that is an antigen test, the 15-minute rapid one, or the PCR test.
Thanks, Rosie. I'll just encourage people, we're I think running out of some questions, so please encourage you to we want to make sure we get everybody's questions. And here's one I know we haven't gotten to. I kind of stayed in the vaccine and COVID testing. So Provost Storr, is a question for you regarding aerospace and the recent shutdown that they did for aerospace. So the question is, can you confirm there has been a day shutdown in the aerospace department? Has there been a COVID outbreak in this academic area, maybe more so than other areas? If so, thoughts on COVID testing. So could you just clarify the event that aerospace did last week?
Sure, yeah, last Wednesday, the flight operations leadership decided to do a safety stand down. They made that decision not because there was an outbreak or a huge rise or spike in among instructors or students, but as a reminder about safety protocol. And they've done a fantastic job in flight operations. Students have been following protocol, particularly when they're flying, but it was a reminder for everybody to consider their behavior outside of the cockpit. So your behavior after hours, outside of campus. We know that on campus, because of our protocol and our safety features, we don't know of any cases of infection in the classroom or in the cockpit, but we do know that people engage in the community and may go to parties or bars or other events where they're gathering, they're not wearing masks, they're not washing their hands. So it was just a great day to say, let's pause and remind everybody of the importance of following protocol, even when you're off campus. I'm really proud of flight operations, the team there under Dick Schultz, Brian Willis, Jeremy Rosler. They made that decision to have the safety stand down, again, just to focus on behavior in and outside of the cockpit. There was also a dean forum in that evening, I think that was Wednesday the 2nd, where the dean and others could answer questions of students about that day. So we're real proud of them.
Provost Sturz, while we're talking flight operations, we've got a question. Is there a formal final day that flight students can have a lesson this semester? So is there a plan for when flight operations might be halted for the fall semester?
I don't have the answer to that. I will text one of my colleagues in aerospace and see if they can answer that question for me and get back to you.
Sounds good. We'll watch that one. So whoever's got that in the chat will either come back or we'll figure out a way to get it to you. Thank you. Another question, and I'm just reading. Rosie, I have heard that the antigen tests have the best results if someone has symptoms versus using with those that are asymptomatic. What is your knowledge about this? So if you could please speak to the symptomatic of the antigen testing.
The antigen test works different than what we do the deep nasal swab test, the PCR test. So the antigen test is best used for symptomatic patients. It will pick up the virus with a higher level of virus, which is present when somebody is symptomatic. That was the original purpose for the antigen testing. However, there has been evidence shown that even using it for surveillance mass testing has been successful in picking up asymptomatic cases. So just a long story short, there is value in doing surveillance testing with the antigen test as well. It is not the gold thing that we would like for the PCR, but you trade that off for having the rapid response and the rapid results.
So while we're waiting for we're trying to get an answer to the one question that is open. I don't have any other additional questions. I will just remind people that we have upcoming testing events. We are testing at the High Performance Center every Tuesday and every other Saturday. All of the dates and times are available on the website. That will not stop when winter break happens. So I know we have testing on December 29th. That's one date that just stands out. And so please know that testing will not stop even though we're in winter break. We know it is a valuable resource to our students who might remain on campus as well as to members of the Grand Forks community. So those events will continue and you can find the dates and times on the website. There's no more questions. And so I want to give it some time. Oh, yep, Provost Storrs, go right ahead.
Okay, got it hot off the presses. We are open through the holidays, closed over Christmas for 3 days and New Year's for 3 days. So that's from Dick Schultz in Flight Operations.
Thanks, Provost Storrs. So for the question, there really isn't a formal final day. There's just a little stopover the Christmas Day holiday and the New Year's holiday.
Correct.
So Rosie, I'm going to come back to you with a question. Isn't there a high level of false positives with rapid testing? Do you recommend asymptomatic positives get a PCR test if they test positive?
It's kind of, if I'm hearing you right, I would say it's kind of the other way around. There's a higher rate of false negatives. That the positives are pretty much positives, but our guidance will be if somebody is symptomatic, meaning they have any of those symptoms, and they get a negative antigen test, we want them to get a PCR test because we could miss a positive. So again, the rate of false positives is not that high. They're pretty much a positive if they're positive, but we do have to wrestle with, there is a certain degree of false negatives that it's not high enough to pick them up. Anybody have anything to add to that?
I would just add that there's several different antigen tests available, and there have been reports, at least in the media, of some false positives. We are pretty confident with the antigen test that we're going to be using, the Binax Now, made by Abbott, that it has pretty good what we call specificity. That is, it's pretty unlikely, not impossible, but pretty unlikely to have a false positive. The bigger concern, as Rosie said, with this product, especially in asymptomatic individuals, is that it may be falsely negative, but the number of false positives is pretty low based on the information that we have. And in fact, we have some information from our own North Dakota Department of Health that actually confirms that it is not common to have a false positive, that is a positive test when there's no evidence of disease.
Thank you both for the additional clarification. Again, I think we've gotten all of the questions answered in the chat. Nope, here comes one, so I'll just read it here. If our daughter is well, Rosie, this one's going to come to you. If our daughter is well, gets tested on Tuesday, gets a negative result on Thursday, and travels home on Friday, can we be pretty comfortable that she didn't bring the virus home? So again, got tested on Tuesday, gets a negative result on Thursday, and then travels home on Friday after she's gotten a negative result. Can we be pretty comfortable that she didn't bring the virus home?
I would say that that person is probably doing the best that they can to be as safe as they can. The test is a point in time test only. So you are negative on the day that that test was taken on Tuesday. It is not to say that you couldn't have been exposed and turned positive in the next couple of days. My advice would be to test and then the famous lay low until you go home. So if you, yeah, who's that sings that? So anyway, Lady Gaga. So test, and if you have a negative result, keep yourself away from crowds, people, risk factors until you go home so you don't take that extra risk of taking it home to somebody.
Thanks,
I
Rosie.
think Rosie has good advice. What I would say is I would have more confidence that the person is non-transmittable the closer to the test that the time is. As more time elapses, people who were exposed that can allow enough time for the virus to replicate so that the person can become infectious down the road. So a negative test today, I would feel pretty comfortable in having my daughter come home tonight with a negative test. But a couple of days from now, the negative test today does not mean that she's still negative several days from now. So I agree with Rosie. It's the best you can do under the circumstances, but don't get arrogant about it and assume that the negative test means that you're non-transmissible. Lay as low as possible, just as Rosie said. Better to get tested and have it negative than to not do anything, but it should not be considered a life insurance policy that you don't have COVID because you could.
Thank you, Dr. Nguyen. A question, students traveling, and we did ask this one, but I think I want to make sure that we did get the answer provided really clearly. Students traveling, and Chief Plummer, I'll give this one to you. Students traveling out of North Dakota to their home in another state, does that student require a COVID test prior to coming back to campus after the winter break?
Right now, it's not required. However, it is highly recommended that anytime you travel, especially coming back into the Grand Forks area, that you visit one of our testing locations and receive a test. We will offer additional testing dates prior to the start of the spring semester.
Thanks, Chief. So we've reached another lull. We've got about 10 minutes left, so I'll probably do that. If you've got any additional questions, please include them in the Q&A. We want to make sure that they are answered. I will also say if for some reason we didn't get your question answered, or if you've got a specific personal circumstance that maybe warrants some additional follow-up, please feel free. You can email me and I will get it to the appropriate person. You see my name on the screen. It's at a dot between first and last name and an @und.edu, and I'm happy to get your question directed. We want to make sure the students and parents and family members have the answers they need, and we know tonight we keep the responses really to broader general questions, but if you've got a specific circumstance we can help you with, by all means, please reach out to us. We want to make sure that we're addressing them. Yes, Provost Storrs.
I've just been getting some more details about when the flight training will be closed. So I wanted to give that. I wrote it in the message as well, but they'll be completely closed between December 24th and 27th and January 1st and January 3rd. So no flights those dates, but otherwise they should be able to accommodate folks.
Thanks, Provost Storrs. And I will just offer, and then I'm going to turn it over to President Armacost. We've seen a lot of thank yous from parents in the chat, and some of those are parent names that I recognize. And so it's nice to see our families. And we just want to say thanks to our families and students for the partnership that they've shown us this year. We know that parents have worried about their students being far away. We know we've had some questions to answer and all of that, but we really appreciate your commitment to the University of North Dakota and the faith that you have put in and trust you've put in us to educate your student. And so my thanks to all the parents who've joined us this evening and for their ongoing partnership with us. We can't do it alone, and we value that greatly. And so given now I'm getting mostly thank yous and not questions, I think that is a sign, President Armacost, to turn it over to you to wrap us up this evening.
Thanks, Cassie, and thanks to all the panelists. Most importantly, thanks to the students and family members for joining us. This is hopefully good information for you, and let's continue to make great decisions to keep yourselves safe and to keep all those around you safe as well. Traveling back and forth between Grand Forks and hometowns over the holidays, take precautions, do all the things that Jed Shivers said earlier, and by all means, Rosie Dube wins the Great Lyric Recognition Competition. Who knew that Rosie Dube was a Lady Gaga fan? But let's encourage everybody to lay low before you go. And everybody have a great night. Thanks for joining us. We'll talk soon.